Singapore is preparing to more than double the number of community bed spaces to help care for COVID-19 patients during various stages of their illness and recovery. 23,000 beds across various facilities are expected to be added by June, in addition to the existing 18,000 beds. The multi-ministry task force handling the disease response says it's part of managing space requirements as infections rise. Now, for the latest on this, let's cross over to our reporter, Cheryl Goh, who was at the earlier virtual news conference. So, Cheryl, tell us then more about this strategy.
Well, Steve and Glenda, so with the cases here continuing to spiral, the plan is to ensure that there is sufficient hospital capacity for those who really need close medical care. But there is still a range of support for other patients. Now, for instance, if you're suspected to have COVID-19 and have gone for a swab test, instead of going home after, you'll now be placed at a swab isolation facility, such as the Civil Service Club at Loyang, while you wait for your results. Now, if the test comes back negative, you can go home. For migrant workers at the dorms who have tested negative but may have other illnesses, they'll be housed in dorm isolation facilities like the Home Team Academy for up to 5 days. Now, if your test comes back positive but you have mild symptoms, your journey then takes you to a community care facility such as the Singapore Expo or D Resort, where bed spaces will double to 20,000 by end of June. And after 2 weeks, if you're clinically well and don't need any more medical care, you'll still need to be isolated while you're being assessed to see whether you can be discharged. And this will take you to a community recovery facility, such as the SAF Guillemard camp. Now, 2,000 such beds are available now, and this will be brought up to 10,000 at these recovery facilities by the end of June. And of course, for the sicker patients, the intensive care unit capacity at hospitals is being ramped up to double. Hospitals are taking active steps to increase capacity by reducing non-urgent clinical works. There are also dedicated wards that may be activated into ICUs if necessary.
While we have sufficient capacity at the moment, I do want to preserve the buffer that we have, and we must never take a healthcare capacity for granted. It is still important for us to observe the safe distancing and the circuit breaker measures to reduce the number to the extent possible. And even the cases in the dormitories, we also have a plan to address these issues, to make sure that we manage the cases properly, to minimize the risk of complications from these patients, and to also to reduce the mortality. So I think these are our key objectives from a medical point of view. So ICU capacity, while we have sufficient, we should never take it for granted, and we should continue to ramp up as much as we can and to reduce complications as much as we can.
And in terms of the manpower needed to run this, we are getting a boost from the SG Healthcare Corps. 3,000 healthcare individuals from the private sector as well as former healthcare workers have signed up so far. And the task force also said that all are welcomed, and even those with non-healthcare experience can also sign up to help.
Cheryl, now we're seeing what appears to be a decline in community cases. So does this mean that the circuit breaker measures can be relaxed soon?
Well, Glenda, you're right that community cases have indeed come down in the past few days, but the key message is that we're not out of the woods yet, and this is why. The government says it's currently conducting extensive testing, including in vulnerable areas such as nursing homes. And as it does that, it wouldn't be surprising if numbers rise once again. So now with these infections would be those that are described as cryptic or hidden because they're either asymptomatics or their symptoms are so mild that they perhaps self-medicate and just get better. So they don't show up in the system. And the bottom line really is that authorities are looking at the numbers very closely. And if it is really a situation that community transmission is decreasing, then yes, some of the circuit breaker measures may be relaxed, but in a very careful and calibrated manner. It's back to you.
Indeed, as it should be. Thanks very much, Cheryl, for that update. Cheryl Goh with updates on the COVID-19 pandemic.